This is the Visible Voices podcast. I'm your host, Dr. Resa E. Lewis. Audience, in today's episode, I'm speaking with Dr. Tina Shah, a physician who is triple board certified in internal medicine, pulmonary medicine, and critical care medicine. The reason we're speaking, though, is because Tina is running for Congress in New Jersey's 7th District. Tina has served as a White House Fellow during the Obama administration and became the VA's first National Director of Clinician Wellbeing. There, she expanded primary care access for veterans by optimizing electronic medical record workflows. In 2022, as senior advisor to the U.S. Surgeon General Vivek Murthy, she created the nation's first federal strategy to address clinician burnout and the healthcare workforce crisis. Most recently, she served as Chief Clinical Officer at Abridge, which is an AI company working to eliminate clerical burden so clinicians can focus on patients, not paperwork. Now, she's running to unseat two-term Republican Congressman Tom Keene Jr. in one of the most competitive districts in the country. Tina's running on what she witnesses in the intensive care unit, a system designed to make patients broke and sicker, prioritize insurance company profits, and burn out the workforce trying to actually save lives. So, Tina, welcome to the Visible Voices podcast.
Resa, thank you so much for having me. I'm so excited to be here.
I'm going to jump right into it. Your run for Congress. Take us to that time. Take us back to when you're like, I'm going to do this. And what are you running on?
I think my story was probably a culmination of years of just working in the broken system that you and I both know, also known as U.S. healthcare. And Resa, I'll be honest with you. I still watch my colleagues just slog it out and sort of be resigned. They're like, we're going to do the best we can for our patients, or the shoe's going to drop on the other side. We're going to sacrifice time with our families because we got to do what we got to do. And I think this has been something percolating in my mind for some time. But the break point was when we started watching RFK Jr. make decisions that were completely against the science. And that was where I decided I have to step up. I have to do something. And right before I officially decided that I was going to run, I actually went down to DC to have some meetings. I met with legislators, especially several congressional members that are physicians. And I met with organizations that are very aligned with, where I was. I happen to be running as a Democrat, and I am a woman, and I am a doctor that is part of the STEM community. And so this was really incredible because the feedback I got was, yes, this is exactly what the country needs. And so I came back to New Jersey. I did the same thing. I asked for input. I went across the district, and after that, it became very clear. In order for me to do my job as a doctor, I have to step up, and that's why I'm running.
I love it. I have actually spoken with a few physicians and healthcare professionals running for office, and it's super exciting to me to see and to understand this journey. In your intro, I talked about burnout, and it's something you just referenced. We know about, it's epidemic in healthcare. You've talked about having the privilege of being burned out. And I'm wondering if you can take us back to that time and tell us more, describe that more, and why that directly relates to this decision.
We will go through many periods of burnout in our lives, not only as doctors or as healthcare professionals, but I would argue pretty much every industry has this constant threat. I would like to define burnout, though, because we use it in many different ways. And for me, this is a chronic stress state when you know exactly what you need to do. You see the demands of the job, but you literally don't have the resources to do so. And so you're stuck in this place where you feel like, did I help anyone? And we like to use the classic definition of burnout here that deals with having either emotional exhaustion or a sense of cynicism, or just a lack of feeling like accomplishment. And if you have any one of those, then you fit the medical diagnosis of burnout. But I think, again, we all know what this feels. And the first time I got burnt out, I was in my medical training. I was a pulmonary and critical care fellow. And what I remember is that I had the privilege still of taking care of patients, but all of a sudden they stopped being as human as they really are. I wasn't able to fully connect, and that's always tough.
Yeah.
And what I realized then was that I was spending so much time typing into a computer, looking through faxes when I should have been spending time with the patients that I took an oath to serve. So that disconnect with all of that menial work, it really put me out of whack. And I'm so glad that happened because that same year, I got the chance to lobby my US Senator Dick Durbin. I was training at University of Chicago, and all of a sudden, I had this glimpse of what would it be like to be at a policy level, making the changes in government that would trickle down to people like me, practicing doctors, and more importantly, to patients. I mean, what would it look like if you make a change there? Couldn't it change lives in a much grander scale?
Yeah. I mean, first of all, I love that you just defined burnout. I respect and admire describing the privilege of experiencing burnout because it's true. Like, you know, in the emergency department, many patients come in with back pain and you're like, okay. And you, until you literally experience back pain, you're like, oh my gosh, that is humbling. And you are able to transform the experience into action. And this is the action that we're talking about today. So, speaking of definitions, I'm going to define civic health because I truly consider civic health something to which we should be committed. And civic health falls under this umbrella of health. So, civic health
Yeah.
is a community's capacity to solve problems and promote well being through active citizen participation, strong social connections, informed engagement with government, and a robust civic infrastructure, leading to better health, higher employment, and more resilient communities. How does that resonate with you?
I love this. I mean, this is like looking at the forest, not just the trees. And this is the ultimate American dream. We talk about being able to provide for your family and for your children and send them to college, but there's this other piece of feeling intimately connected with your community and that you implement things and you work together, and that is something where the tide rises all the ships. I love this. And actually it ties in really well with how we think about workforce well-being across the medical professions. It's the same thing. What are big system things we can do that allow people to thrive? Because I'll be honest, I believe that every single person here in our country and arguably on earth, they are an elite athlete in some form, whether it's being an elite mom or being an elite nurse or being an elite entrepreneur. And what we want to do is make sure the environment is structured so that they can reach for the stars. And that's just not the positioning that Congress has. They seem to be focused on fighting about keeping their seat versus actually doing something for the American public. That's what I've seen with my member of Congress, Tom Kane Jr. here in New Jersey.
I want to pick up on something you said. You mentioned RFK Jr.,
Yeah.
and you were recently quoted in the Wall Street Journal.
I think every medical trained professional, especially us doctors, will attest. We have had years of training, and what we've watched is RFK dismiss the science and the medicine that comes into making the decisions we make. So I got quoted saying that I have 14 years of medical training and RFK has zero. And I think that's illustrative. This is a man who not only has no medical training, has decided to throw out the scientists and the medical experts out of health and human services. So he is making decisions based on his thoughts versus fact and science, and it hurts. I mean, I think the one that still hits home, which is recent-ish, is the fact that he decided to cut hepatitis B and flu from the childhood vaccine schedule. Now, we're in one of the highest flu seasons since the 1990s. And in Jersey, recently, unfortunately, a child died from flu. And we didn't have to have that or see that. How many more children are going to get harmed because of RFK deciding to do something by political whim versus science when we've had the science for, years?
Yeah. The misinformation epidemic and speaking up as physicians, again, is something that I support and I think is important. You've spoken on vaccinations, you've stood up on healthcare. What else are you standing up for in your run?
Wow, how much time do we have, Risa?
Pick
Well,
one. Pick one.
okay, I'm going to start with affordability. Because you know what? We are working our butts off, and at the same time, a large part of our country, and I see this in New Jersey's 7th, we still don't have enough money to make sure that we can pay rent and have groceries and manage our electric bill and get healthcare. I mean, it's all intimately connected. And so what we've seen is the impact of the Trump administration, and the chaos is what is making it hard for us to have affordable living or an affordable life. I'll start with the tariffs, for example. And I'm going to just pick a healthcare example, but there are a lot of different ones here. When Trump put tariffs on the EU, one of the biggest things that we get from the EU are medications. And I will tell you, my patients were holding off on filling their scripts because they didn't know how much it was going to cost. And some of them ran out. And
Yeah.
so what we watched is swinging prices. We watched the price of coffee go up. I can't I will tell you, I definitely am a coffee fiend these days, although I'm trying to get off. But when I talk to my friends that are business owners of coffee shops, they talk about how high the prices have become because the tariffs impacted coffee import. And so what we're seeing is affordability from all fronts. And here we talk about one, restoring checks and balances in government. We can't let Trump just throw out a tariff whenever he feels mad or
Yeah.
when he feels that he's been wronged because it actually hurts the American public. I'm running in one of the top 5 races in the country. We only need 3 seats to flip the House, and New Jersey's 7th is going to be one of them. And that's how we actually have rational thought when we make these big policy decisions that affect our pocketbooks. And second, wouldn't it be nice to not put most or a significant chunk of your salary towards health insurance? I mean, this is about putting money back in our pockets. And I know you didn't ask for this, but let me go ahead and say it because last week Trump came out with his great healthcare plan. And what he promised to do was put money directly in the pockets of American families. So here's what he has so as far as we can tell from the legislation that's been proposed, is that each family gets $3,000 annually. But I checked last week, and for a family of 4 in New Jersey, it's going to be $18,000 a year to pay for premiums. So how is 3,000 going to cover it? I mean, we need to bring in people that understand healthcare and more so bring stories of people, real people. And I intend to do that with my patients. And that's how we're going to make good policy that affects our wallets and allows us to live.
I'm all here for the stories and use the word illustrative. And I'm going to use that word right now. You just talked about patients and scripts and basically rationing filling meds. Is there a specific example for listeners that are wondering what that looks like, whether it be diabetes or high blood pressure or fill in the blank prescription?
Yeah, actually, I was working over the weekend and I took care of a patient who got hospitalized with a life threatening complication of diabetes. Many of us know this as DKA, diabetic ketoacidosis. And this is a gentleman that was on a very, very effective regimen of meds. He was taking one pill, metformin, and he was taking one weekly injection. And what happened is that he lost his insurance because he switched jobs. And so his new job as a substitute teacher did not include insurance, and he just couldn't pay for it out of pocket. So he did the best he could. He told me, "Hey, I'm checking my sugars. I modified my diet, but it wasn't enough." He landed up in the ICU. We treated the DKA, but you know what? If you are hardworking, you are producing, you're productive. He's a substitute teacher. How is this happening to him where he can't afford basic medication?
Thanks for that. And I think, again, listeners will be like, oh my gosh, I get it. I think they got it, but that was really sort of very, very clear, granular, specific. So you've talked about money and campaigning and building a campaign, your network with legislators. Give us one behind the scenes look into what it's like to do this process. Like, what does it take, or what would be a surprising aspect that people would never think is a part of running for office?
Ooh. Well, first, I think many of the listeners of this podcast have pretty intense jobs. I'm assuming if they're in the medical field. And I will say that as an ICU doctor who, when I'm on shift, it's a 12-hour shift. And as we all know, it's generally more than 12 hours. On one hand, you think to yourself, well, in a campaign, You have time to sit down. You have time to eat lunch. You have time to go to the bathroom. I don't often get that as an ICU doc, but you are really in the limelight. You've decided to open up your personal life and your professional life to the American public. And the thing I think that people don't get, and I think we all have heard about this, but we are really dealing with the need for campaign finance reform. I spend the majority of my day actually fundraising when what I want to do is be out and about and more in the district. And it's been a privilege to, to go across our 6 counties and meet people and hear from them not only what is wrong, but many people have policy solutions that are really sound. But the way our election system is designed, candidates have to raise exorbitant amounts of money, and that is how you are judged. So I think in this case, healthcare is the top crisis in the country. I literally can't take it anymore watching my patients come in as, the insurance companies have blocked them from getting critical tests as they watch that it's too unaffordable to pay for medication. So I'm going to play this game. These are the rules. But we should be really focusing on what the needs of the district are versus raising dollars. That's the challenge.
You've mentioned demographics. You've mentioned being a woman running for Congress. So if elected, you would be the first member of New Jersey's Southeast Asian community to represent the state in Congress. How does that feel?
Oh my God, it feels incredible. It feels incredible. Mostly though, Risa, what I think about is if I, Tina Shah, in 2026, I'm going to get elected, what are the next generations going to do? Who's going to do something even bolder and bigger than anything I could dream of in my lifetime from the the South Asian community or the Asian community at large. And I think part of this is about representation. We've grown up in this incredible country, but we haven't seen ourselves in positions of leadership. And on the other side, our country is truly a melting pot, and we have a Congress where it's lopsided. We don't have representation that matches the people that live in our country. And it will be a privilege to go ahead and fill that gap.
Your voice. When did you realize you had a voice, and when did you start using your voice?
I think my mom told me I had a voice. I think I was a closet public speaker, but when I was young, I was so shy, and my mom would always tell me to speak up. And over the years, I honed it. But in this context, I realized I had a voice when I got burnt out, and then I got to see what is it like when you're a physician doing advocacy. And I joined my state medical society and I joined the American Medical Association. And all of a sudden we were advocating for our patients and for our profession. And that felt really, really good. And it was a taste. I then went on to get a master's in public health at Harvard. It completely opened my eyes into system thinking and also how is US healthcare structured. And I've now spent my career going in and out of government and continuing practice. And that back and forth has really allowed me to be effective. Risa, I got to jump and tell you a story because I think this is the greatest achievement I've ever had so far. Can I tell it? Okay. Many of us deal with whether it's us as a patient or as a caregiver or us as a person in the medical team, but many of us have dealt with this insurance process known as prior authorizations, where you decide something with your doctor. And this is why I say it's not just the patient and the doctor in the room. We have not only the politician, but the insurance company in the room. So let's say we decide you have terrible back pain, you need that MRI. You're in excruciating pain. And then the doctor's like, whoa, whoa, whoa. Let me get pre-approval. I'll let you know in a week what the insurance company says if it's covered or not. We all have this story. And I'll tell you, maybe the straw that broke the camel's back was my mom had chest pain, the cardiac type, the heart attack type, and her insurance company denied her cardiac catheterization procedure. And I thought to myself, like, how is this possible? It's so classic. And we fought, and she got her, testing done, and she's fine. But too many people are getting essential medical care denied. So I started a grassroots network. It was a combination of patients and doctors and nurses. And over 18 months, we decided to take on the insurance lobby here in New Jersey. And so this was weekly meetings where we identified champions. Each champion then roped in 5 of their friends, who roped in 5 of their friends. And lo and behold, we had tens of thousands of letters sent to key state legislators for a healthcare bill that would rein in insurance companies from doing this prior authorization practice. And lo and behold, we beat the insurance lobby. They lost most of their points, and that bill passed near unanimously. It is law today. So if you have health insurance that the New Jersey state government regulates, you can't have medically necessary care denied. After you see something like that, you get real passionate and real bold as to what an individual person can do. So I'm fired up. I can't wait to go to DC because I've already gotten the playbook.
This is such an important story. I literally have these stories with other physician friends about how we have to advocate or how we step in for family members, close friends. And it should not be a determinant of health that you have someone in your family or in your friendship network who is a physician. That should not be necessary to take care of people and for people to feel like they're getting reliable, good, safe healthcare. So thank you for that story. Congratulations on the law, and just, exquisitely powerful right there. So
Thanks.
as you know, microskills, I'm all about small intentional actions and behaviors that we can start today to, move towards a larger goal. So for audience members that are wondering, how can they be more involved, specifically in civic health and or in supporting you and your campaign? Maybe give us 3 actionable behaviors that people can take on and consider integrating right when they stop listening to this episode.
Oh, I love this. And Resa, I have your book. I don't know if you can tell, but I have a bookshelf right behind me and your book is there and it's incredible. This concept of micro skills really hits. I mean, we don't have time. We're busy with life and work and family. And here are the 3 things. First, if you can think of one issue you're passionate about, just do one thing about it. I think the easiest would be send your local or your congressional member an email and say, I'm passionate about this. Like, can we work on this? Or I noticed that this isn't happening. Can we do this? Because that's how it starts. Second, I want you to stand up. And I'm hoping it's for me. I would love for people listening to come to my website, drtinashahforcongress.com, and sign up to volunteer. I think that would be huge because you know what? We are building a massive movement. We're starting in New Jersey's 7th district, but as you know, it takes a village. And so whether you live in the district or whether you live outside, if you care about our country, I want you to be my teammate. I need to be your teammate. And can we do this? And the third is, and I will just be real with you, as I mentioned, this is a game where you need to fundraise, and that is primarily how you get to every single voter. So there's some real aspect to this of if we have enough money, we can get the message across that America's in critical condition, and that's why doctors need to get into Congress. And so please come to my website. Again, it's www.drtinashahforcongress.com, and please chip in. Anything that you're willing to contribute helps. And just know that I'm also struggling between meal prep and practicing in the ICU and running for Congress. These are the real experiences we want. We don't want politicians in Congress. We want real people now.
So, Tina, what should be the title for our episode?
How to save ourselves and save the country.
How to save ourselves and the country.
Yeah.
Dr. Tina Shah, thank you so much for joining the Visible Voices podcast.
Thanks for having me, Dr. Lewis. It's such a pleasure.
The Visible Voices podcast amplifies voices in the healthcare, equity, and current trend spaces. Our team includes Dr. Giuliano DePortu and me, Dr. Resa E. Lewis. Find me at Resa E. Lewis MD on social media or visit thevisiblevoicespodcast.com. Find us wherever you listen to podcasts and watch our episodes on YouTube. This podcast is for education and entertainment purposes only. The views and opinions expressed by our hosts and guests are their own and do not reflect the opinions of their institutions. Information shared here should never substitute for clinical judgment or for medical advice. Together, we're making healthcare more equitable, one visible voice at a time.